Pfizer Canada has officially released its latest COVID-19 injection, this time targeting the LP.8.1 Omicron subvariant. It's a variant that's actually already on the decline, and Health Canada has authorized this product, not through a traditional rigorous review, but under a regulatory shortcut that's been quietly made permanent. Let's dig in. This approval was essentially granted under the interim order, which was Canada's version of emergency use authorization rolled out back in 2020. At the time, we were told it was a temporary measure, a way to get these novel, unproven products to market quickly in an emergency.
It is extremely important that they go through all the full processes necessary so that every parent can have confidence when these vaccines do get approved, that they will be safe for their children, to keep us all safe, to keep them safe, to keep our communities and schools safe as we move forward. And therefore, what I'm very pleased to be announcing today is that we have worked directly with Pfizer, and shortly after the time comes for Health Canada to approve those vaccines for pediatric use, we will receive millions of doses in Canada, enough to get all kids under between 5 and 11 vaccinated as quickly as possible.
But instead of being eventually rolled back, it's now been baked into Canadian regulatory process. Through amendments to regulatory framework, this emergency pathway has been normalized. Now, pharmaceutical giants like Pfizer and the like can submit rolling applications for new products, meaning they don't need to conduct fresh, full-scale trials as long as their product is deemed to be close enough to a previous one. Let that just sink in for a minute, because it means that these modified RNA injections, which still lack long-term safety data, by the way, are being approved based on assumption, not fact, not evidence, or science. It's all part of a broader move called agile licensing, changes to the Food and Drug Act pushed by then Health Minister Jean-Yves Duclos, who, it's worth noting here, is not a doctor or a health professional at all. He's an economist. This so-called agility allows companies to submit partial data called rolling submissions after their products are already on the market. These companies literally submit their safety data as it rolls in. And while Health Canada says this is about speeding up innovation, critics are sounding the alarm that it's really about serving corporate interests, not protecting Canadians. Dr. Susan Natche, a retired pediatrician, raised the red flag with me over 2 years ago. She warned that this new regulatory model would allow novel products like the modified RNA injections, commonly referred to as vaccines, and the ones being developed down the pike to sidestep traditional safety benchmarks, even though their long-term effects remain unknown. She pointed to vague terms like advanced therapeutic products, which Health Canada still hasn't clearly defined. So what kind of products are we talking about here? The government titled document Targeted Regulatory Review Regulatory Roadmap is any indication. This includes everything from AI to nanotechnology to gene editing. These are not your everyday cold medicines or, herbal teas, for instance. Those are the same natural health products that Health Canada is cracking down on. No, instead, these are experimental platforms now being fast-tracked into human and even veterinary use. Yes, that's right. The same regulatory loopholes apply to animals and, by extension, possibly even the food supply. Dr. Natche called it a backdoor pathway that was quietly created in 2019 under, you guessed it, Yves Duclos as Minister of Industry, allowing products to be marketed without first proving they're safe or effective, as long as the Minister of Health decides that the benefits outweigh the risks. But who decides what those benefits are and for whom? Well, let's take a little deep dive into the real data when it comes to the latest authorization. In Ontario, the LP.8.1 subvariant, the one that this new shot is supposed to target, has already declined from 5.2% prevalence in July to an estimated 1.2% by the first week of August, which is the last reporting date, dwarfing other variants' growth rates during the same time. Now, if Ontario Public Health's projections are any indication, by early September, which is when this shot will be widely available, the LP.8.1 variant could be virtually non-existent. I mean, it kind of already is. It was the third runner-up for Public Health Ontario's variants of concern monitoring, representing 6.2% of the 385 cases they sequenced. So why are we greenlighting yet another round of modified RNA injections rushed to market, authorized without full testing, and aimed at a variant that's already disappearing? It seems more about keeping that pharmaceutical conveyor belt running under a regulatory system that has been rewired to serve industry over integrity. The same companies profiting from these injections are also defining the standards for their approval. That should concern everyone, because as Dr. Natshe told me, the quest for economic gain should not dismantle the safety nets that protect Canadians. For Rebel News, I'm Tamara Ugolini. If you agree that fast-tracking experimental products with no long-term safety data using outdated variant targets isn't the right kind of science that Canadians signed up for, then make your voice heard at nomoreshots.ca, where you can call for the reversal of market authorization for these products. All of that and more at nomoreshots.ca.